Hello, my name is Mr. Tawqeer Rashid. I'm a consultant vascular and endovascular surgeon based out of Manchester. My NHS practice is at Manchester Royal Infirmary. I also do and see private patients at the BMI, the Alexandra Hospital, at the Spire Manchester Hospital, and I also cover colleagues at the Christie Clinic who need specific vascular input to their patients. So an aneurysm is an abnormal dilatation of a blood vessel, i.e. when a blood vessel becomes abnormally large. Now there's different definitions of this. Sometimes this is 50% above the normal size. Sometimes it's 100% above the normal size. And what's happening there is the wall of the artery is weakened, and over time it gets larger and larger, a bit like if you blow up a balloon, and over time it just gets wider and wider and wider. And the risks of this are that depending on where the aneurysm is located, either it can burst or rupture, causing bleeding, or sometimes what happens is that it gets filled full of thrombus, and that thrombus can then go down into the arteries beyond it and cause ischemia or lack of blood. Typically, this happens in the leg arteries. So the most common aneurysm that we see in vascular surgery is actually the aneurysm of the abdominal aorta. The problem with this aneurysm is that it is widely known as the silent killer. And the reason is because as it gets bigger and bigger, most people simply won't notice it. It's very rare to notice it indeed. Very occasionally, it may press on something that causes you a problem like back pain, or you usually find it when you have a scan for something else, and at the scan, it picks up that you've got this aneurysm. So by and large, the vast majority of patients will not see or feel the aneurysm growing inside them. There's no doubt that aneurysms do run in families, so there's probably a genetic predisposition to it. What we do know is that there are certain risk factors that are associated with the development of aneurysms, and these are actually the same risk factors that you would get if you end up with a heart attack or a stroke or ischemia of your legs. Principally smoking, but also hypertension. And also, as you get older, it's more common, and also if you are male compared to females. So the typical risk factors that we see, there is probably some association with hypercholesterolemia, although that's probably not as important as say, smoking. Aneurysms are very slow growing. They occur over many years, if not decades. And in general, they grow at about 10% a year in the abdominal aorta. So typically they'll grow at 1 to 2 millimeters a year. That's why, for example, if you are part of the screening program, which is a national program for 65-year-old males, they may pick up an aneurysm when it's just 3 centimeters in size. But by the time we'd actually intervene on it, it could be many years, if not decades afterwards. Well, that's a really good question. Generally speaking, aneurysms are not something to worry about as long as they're at a certain size. And generally speaking, if you look at the abdominal aorta, the size that we use to determine safety is about 5.5 centimeters. And the reason being that we know that if it's below 5.5 centimeters, the chance of you coming to any serious harm from it is very low, less than 1%. What does tend to be the case is as the aneurysm gets larger and larger, the risk of this causing a serious problem, namely rupture and unfortunately death, goes up pretty much exponentially. So that if it gets to say above 8 centimeters, then your risk of rupture is probably over 50% within the next year. And we generally tend to intervene when the aneurysm is above 5.5 centimeters before it gets to this very high risk stage where rupture could occur at any point. In terms of prevention, probably the most important thing is to look after your cardiovascular health, very much in the same way as you would for heart attacks or strokes. So it's absolutely imperative that you avoid smoking. If you are a smoker, if you can stop as soon as possible, that will definitely reduce the rate at which the aneurysm grows. But also other factors, for example, blood pressure control, healthy lifestyle in general is good for cardiovascular health as much as anything else, because if you end up needing an operation, you need to be in as fit a state as possible to get through the procedure. Which brings me to my next point is the aneurysm treatable? It is definitely treatable. And there's two ways of treating it. One is keyhole surgery, which for the majority of patients is possible. But in addition to keyhole surgery, you can have open surgery, which is the traditional way in which we treated aneurysms. And in general, most vascular surgeons would still recommend it if you're of a younger age, say in your 60s or below, and in good health, just because we know that if you have a successful open aneurysm repair, then the chances of you having any complications from it are much lower than if you have a keyhole repair, which doesn't have the same durability, generally speaking, over the longer periods of time that you might expect to live if you're a younger patient.